Hello and welcome back to Mammalian Anatomy at Keuka College. Today what we're going to do is continue our conversation about Chapter 13, the central nervous system. And in this video we're going to look at the protection of the brain. In the previous videos we saw that the brain has immensely important functions and it's going to have life-sustaining functions as well. And so what we're going to have to do is we're going to need to protect the brain from damage. So in this section, we'll look at the different structures that protect the brain. I do want you to be aware that the same structures are going to protect the spinal cord. However, they'll be slightly structurally different from each other. So the brain is protected by the following structures: the skulls, the blood-brain barrier, meninges, and cerebral spinal fluid. So let's go through it bit by bit. The skull is going to create a hard protective shell around the brain, as one might expect. But the skull is actually nicely shaped and molded to the structure of the brain. So for example, the frontal lobes are going to rest on the the anterior fossa and kind of sit right there. The temporal lobes are going to rest in the middle cranial fossa, and the occipital lobe is going to sit in the posterior cranial fossa. So anterior cranial fossa, middle cranial fossa, posterior cranial fossa. And they're going to mold nicely around the different structures of the brain. It even goes to the point where there is the sella turcica. The sella turcica translates to Turkish saddle, and it is a bone marking of the sphenoid bone. This sella turcica is responsible for holding the pituitary gland. It is really beautiful, the skull. Even when you look at like real skulls, you can see that there are grooves present in it where the blood vessels would travel along. So it is very tightly bound around the brain, and it's going to help protect it effectively. The next structure is going to be the blood-brain barrier. And the major function of the blood-brain barrier is to separate the brain and the spinal cord from general circulation. So anything that is in the blood vessels may not necessarily be able to enter the brain and the spinal cord. So it's going to limit what can come in contact. So over here, what we're going to have is we're going to have the different structures that will form the blood-brain barrier. It's first composed of endothelial cells. Endothelial cells are going to be the inner lining of cells that form blood vessels. And in capillaries, capillaries are only composed of these endothelial cells. These endothelial cells are going to kind of be tightly bound together using tight junctions. This is a type of cell junction that creates a waterproof barrier, so no material can actually sneak or squeeze past this kind of connection point between two endothelial cells. Material will actually have to pass through the endothelial cells via diffusion or vesicular transport to be able to get past. The next structure is the basement membrane. Basement membrane is a piece of connective tissue that will connect the endothelial cells of the blood vessels to the neuroglia, and it can actually act as a filter as well. So it will be able to filter things based on size. The outer layer will be composed of neuroglia. Here we're giving a specific example of astrocytes. Astrocytes are going to control what can come in and out of the blood vessels. So there is actually a kind of a funny story that I can give as an example. The the example would actually be of drowsy versus non-drowsy allergy medication. Allergy medication is going to be an antihistamine. Histamine is a compound inside the body that will initiate an kind of allergic reaction, those itchy eyes, the swelling, sneezing, those sorts of things. And what an antihistamine does is that it will bind to the receptor for histamine and block it so that histamine can't do its job. Well, there's two types of antihistamines, one that is more lipid-based and one that is less lipid. And what's going to happen is the lipid-based ones are going to be able to cross the blood-brain barrier, and it will actually bind to histamine receptors that are found in the brain. And when it does this, it's actually going to cause that drowsy sensation that a person will feel. Pharmaceutical companies found that this was undesirable characteristic of their medication because it made people feel drowsy and not be able to focus. So they redesigned their allergy medication so it wasn't as lipid, so it had a much more difficult time traveling through the blood-brain barrier. So that's how you get non-drowsy allergy medication. So now for the funny bit. So just some background information. I got my degree in pharmacology and physiology, so I have a good understanding of how different medications work and on like the physiological level. My husband, not so much. So, and because of that, my husband isn't allowed to take medication without asking me first. And the reason why is one day he was having really bad allergies. So he decided to buy some allergy medicine at work. He worked at a bookstore. And what happened is he didn't realize that he took drowsy allergy medication, and it hit him hard, like really hard. And so what happened is that he fell asleep at work. And it was to the point where he was so drowsy that his coworkers drove him home and put him into bed. So that was very nice of him. And I get a phone call saying that at work that I should go home and check on Robbie, my husband, and make sure he's doing all right. He was fine. It's just he was very sleepy. So from now on, I am the person that buys the allergy medication and make sure it's non-drowsy allergy medication so he can function properly. So silly example of blood-brain barrier, but hopefully it can help you remember. Okay. The next structure that we're going to talk about are the meninges. The meninges are layers of connective tissue that are going to surround the brain, and their functions are to cover and protect the brain, and they're also going to cover and protect the spinal cord. And it really is going to help anchor the brain to the skull so that the brain doesn't kind of shake around within the skull. We want to make sure it's all set in place. It's almost like a seat belt for a car. So the seat belt is going to hold you in place as the car is moving around. It's also going to enclose blood vessels, and it will contain cerebral spinal fluid, which we'll talk about a little bit more in a few slides. There are 3 layers of meninges, and they're called the dura mater, arachnoid mater, and pia mater. Mater in Latin means mother, and so we have 3 very different personality types when we come to the mothers that's around the brain. We have the dura mater, which is going to be the most superficial. So if we have the skull here, we have the dura mater here in white and pink. And it's going to be the tough mother, the durable mother. And it's going to be strong and tough and protect the outside and protect the other meninges. And it's going to prevent there from being any damage. It also helps anchor the brain to the skull. I always remember dura mater because one time I was doing a dissection demo and my scissors got jammed because I was cutting through the dura mater, and it was very difficult to get the scissors out of the dura mater. And so I always joke that it's a tough mother beep to cut through. You can put in what the beep is supposed to be on your own. So it's very tough to cut through. Then we have the arachnoid mater. We see another oid word, so it resembles something. What do you think arachnoid reminds you of? I'll give you guys a moment. Yes, it's the spider mother. And why is it called the spider mother? The arachnoid mater is going to actually produce these little tuberculae that are going to connect the arachnoid mater and the pia mater. So it's going to look like a bit of a spider web on the inside. So we call it the arachnoid mater, the spider mother. So I think this is the scary one, the scary mom. And lastly, we have the pia mater. The pia mater is going to be directly touching the brain, and it will actually follow all of the folds and the fissures of the brain deep inside. And pia means soft or gentle mother. So this gentle mother is going to hug the brain and be all sweet and cuddly with the brain. So we have the tough dura mater, the scary spider mater, and the gentle pia mater. Let's talk more about the pia mater. Dura mater. So the dura mater is going to be the most superficial meninge. So we can see on this diagram, we have the dura mater over here, directly deep to the skull. And in the brain, the dura mater is composed of two layers. We have the periosteal layer, which is going to be directly touching the skull. And this is going to be synonymous with the periosteum. So the periosteal layer of the dura mater and the periosteum is the same thing, just so you know. And this is going to follow the shape of the skull. We then have the meningeal layer of the dura mater. It's going to be a little bit deeper, and it will go deep into the fissures of the brain. The meningeal layer is going to be following the shape of the brain more so than the periosteal layer. Normally, the periosteal layer and the meningeal layer of the dura mater are directly, tightly connected together. However, there will be some separation, especially when these two areas surround blood vessels and create sinuses. So over here, for example, we have a superior sagittal sinus. This is going to follow the superior sagittal fissure that is going to separate the two hemispheres of the cerebrum. And so this, you'll see that the periosteal layer is going to follow the skull, while the meningeal layer is going to follow the brain. And so we'll create this like little cavity or sinus. This sinus is going to be important because it's going to connect to the venous circulation, and it's going to help drain the fluid from the brain. So there are regions of the meningeal dura mater that will travel deep into the folds of the brain. So you can see here that the meningeal dura mater is actually following the brain and going deep into the fissures of the brain. These will form partitions and help anchor the brain in the skull, so the different regions don't move around very much in the skull, and they're not going to move around very much relative to each other. And they include three regions: pollex cerebelli, pollex cerebri, and the tentorum cerebelli. So let's look at where those things are. So first of all, we're going to have the pollex cerebelli. That's going to follow the superior sagittal sinus and superior, so the sagittal fissure. and it's going to go deep into between the two hemispheres of the brain. We're then going to have the flux cerebelli. It's going to actually follow the vermis of the cerebellum and kind of be between the two hemispheres of the cerebellum. And then over here, we're going to have the tentorum cerebelli. The tentorum cerebelli is going to separate the cerebrum from the cerebellum. And tentorum, it means tent in Latin. And so it's going to form a tent-like structure over the cerebellum. So those are the three kind of folds of the dura mater. If we in the future have the opportunity to dissect a brain, I think we will do that in AMP2. We'll see that one of the most difficult things to do when removing the dura mater is removing these folds without tearing the brain. So we'll see that in the future. The next one is going to be the arachnoid mater, so the spider mother that forms these kind of spider web-like structures. And in between the dura mater and the arachnoid mater is a very small, thin space called the subdural space. It is very, very tiny, but it's clinically important because sometimes if the brain gets damaged and there is bleeding in the brain, this subdural space will fill with blood and cause the brain to cause it to swell, and it will push on the brain. So clinically, this area is very important. We also have another kind of space. We have the subarachnoid space. So that's going to be between the arachnoid mater and the pia mater. This is going to have those web-like tuberculae that we talked about. And one of the major functions of this is going to be a location where the cerebral spinal fluid is going to be located. So the cerebral spinal fluid is a fluid that is going to kind of cushion the brain, and it will collect in this subarachnoid space. However, it will eventually drain into like the superior sagittal sinus and other sinuses in the brain, and it will travel across and through the dura mater using arachnoid apertures. So the cerebral spinal fluid, it actually flows through and around the brain and eventually will drain into venous circulation using these apertures. So we can actually see this a little bit closer. We have the periosteal dura mater, the meningeal dura mater, then the arachnoid mater. Here we can see the subdural space, and here we can see the subarachnoid space. And these are showing the apertures that will punch through the dura mater and allow for the cerebral spinal fluid to drain into the sinuses and drain into general circulation. The last kind of layer is the pia mater. I didn't put a slide in for it. The pia mater is going to just be directly touching the brain and will be following the curvature of the brain. Next, let's talk about the cerebral spinal fluid. The cerebral spinal fluid is going to surround the brain, and it's also going to fill the ventricles. And in addition to doing that, it's going to fill the central canal of the spinal cord and surround the spinal cord in the subarachnoid space as well. So what are some of the functions of the cerebral spinal fluid? So the cerebral spinal fluid is going to function to allow the brain to have buoyancy. The brain is a very soft, gentle structure that would actually collapse under its own weight if it was not preserved and it didn't have this cerebral spinal fluid surrounding it. So it would actually crush itself under its own weight. So what will happen is the brain has a similar density to the cerebral spinal fluid. So the brain will actually float in the skull within this fluid. So it prevents the brain from being crushed. It also plays a really important role in preventing compressive forces, and preventing severe concussions. So if so it's a little morbid, but let's say a person is moving forward in a fast speed and all of a sudden they stop. The skull may stop, but the problem is that the brain will continue moving forward because it still has that high inertia. And so it will follow, and it will actually continue moving forward, and it would strike the skull. And that can be very dangerous to the brain because the brain is very sensitive and very delicate. And so one of the ways that we protect the brain from these compressive, concussive forces is using the cerebral spinal fluid. The cerebral spinal fluid is going to almost act as an airbag, like in a car, and it is going to cushion the blow. So hopefully minimizing the amount of damage that occurs to the brain. Also, the cerebral spinal fluid plays an important role in feeding and nourishing the brain and removing waste. So the cerebral spinal fluid is actually going to originate from the blood plasma, and its composition will be modified by epidermal cells, those types of neuroglia, and it will allow for different nutrients, gases, water, and hormones to be deposited onto the brain and kind of wash and feed the brain. Also, as the cerebral spinal fluid is going through the ventricles and through the subarachnoid space, it's going to pick up waste products like carbon dioxide, potassium, and things like that. And it's going to pick up those waste products, and eventually that cerebral spinal fluid will drain into the sinuses of the brain and drain into venous circulation. So it's going to help kind of carry that waste product away. So cerebral spinal fluid is very important. It is produced by the epidermal cells. It allows for the brain to have buoyancy. It protects the brain from compressive and concussive forces, and it helps feed and nourish the brain and remove waste. So thank you for listening, and I hope you have a wonderful day, and take care of yourselves. Bye-bye.